And welcome to Houston Newsmakers Extra. I'm with Elena Marks, the president and CEO of the Episcopal Health Foundation. Elena, good to have you continue this conversation. How many people, I've read that Texas is really, in terms of uninsured people, we don't really have much to brag about in that category. Where do we stand as it relates to the uninsured folk in the state of Texas?
We have the highest number and the highest rate of uninsured people in the entire country. More than 5 million Texans were uninsured before the pandemic, and we believe that many more lost their employer-sponsored insurance during the pandemic. We have twice the national rate of uninsured Texans, and we can do something about it.
So you're on the front lines of this, dealing with this on a regular basis. When you get pushback, when people are faced with that kind of information, what is the retort as an example about, well, we can't do anything more or we won't do anything more? What is your response when they're faced with those kind of statistics?
Well, I try to share information that corrects some either misinformation or gaps in information. So, for example, a lot of the information that we know now from the experience of the many states that have expanded Medicaid answers some of the questions that Texas originally had. Is it going to work? Is it going to blow our budget? Is it actually going to make a difference in the health of populations that become covered? And because of all of the work done in other states and tremendous amounts of evaluation, there's now a lot of information that dispels those myths or answers those questions. And beyond that, the things I hear are things like Medicaid's a broken system, and we shouldn't add to it. However, all public polling shows that Texans overwhelmingly find Medicaid to be an important and valuable program, and that crosses party lines as well. More than 75% of Texans believe that Medicaid is a valuable program. So it's a broken system is just not something that's credible by Texans. And so I don't know beyond that, Cambrell, why people continue to oppose it. If we may be stuck in the old ideology of this is something that came out of Obamacare and we're not going to do it. There's a little bit of if people want health insurance, they should earn it, which doesn't acknowledge that you're talking about people who are hardworking and simply don't make enough money to buy health insurance themselves, and for whom the Affordable Care Act made Medicaid expansion the solution for them.
So some states have taken it, they've put it on the ballot. They let people vote on it. Is that a possibility in the state of Texas, or is that something that's not doable the way our government is structured?
It's not doable by direct petition. In some of those states, citizens just got together and started a petition drive to get something on the ballot. That's not something that is permissible under Texas law, but there's actually a bill on file by a Republican representative, Lyle Larson, that would put this issue on the ballot for the public. And so that would be how it would get on the ballot, for the legislature to approve it being on the ballot. And we're convinced that if it goes on the ballot, it'll pass. Texans want this.
So this past week, well, maybe it was a little bit more than the past week, President Biden did something with a waiver that Senator Cornyn was not happy about. In fact, Senator Cornyn was holding up one of his nominees, one of President Biden's nominees, because he was not happy with the waiver that was taken away for Texas. Explain that, because it looks kind of confusing from the surface.
Yes. So here's what happened. In late November, so after Trump lost the election, the state of Texas, without following public notice provisions, filed an extension application with the federal government to extend a pool of funding that largely goes to hospitals to cover uncompensated care. The pool was not set to expire until the fall of 22, so it was not an emergency issue, but they filed it under an emergency provision. And then without having public notice or public hearings, they had 2 public hearings, but the hearings were held after they'd already filed the application. So there was really no public input in the application. And so while that application was pending, a number of state and national advocacy groups wrote to the Trump administration and said, this isn't right. There needs to be public input. We want to have a say in how this happens. And then what the Trump administration did was literally 5 days before he left office, he gave Texas more than they asked for, a 10-year extension of a pot of money primarily aimed at hospitals so that when people get sick enough and go in through the emergency room, some of that uncompensated care can get covered. And what the Biden administration did was exactly what it said it was going to do. In January, they issued an executive order that said they were going to review all of the last minute, late date actions that the Trump administration had taken that would undermine their agenda. And then in February, they sent a letter to all of the Medicaid offices saying that they were going to be reviewing all of these waivers explicitly to see if they complied. And in the course of that review, what the Biden administration recognized, which is something that we knew all along, was that it was inappropriately granted. And so what they've said to the state is, you didn't follow the right process. You are welcome to refile this application. There is ample time to refile the application. We will work with you on the application, but you've got to have the public input. It's got to be a transparent process. And we know from all the advocates that opined on it that there's great interest in this conversation. And so what the Texas administration should do right now is open conversations with the Biden administration about how to work this out. Texas will need an uncompensated care pool, even if we have a full Medicaid expansion. That won't take care of all of the problems we have. Well, it is important that we have an uncompensated care pool, but part of the reason we need such a big uncompensated care pool is because we aren't insuring enough people. There's a coverage solution that actually will improve people's health outcomes, bring in more money to the state than the pot of money itself. And that's the pathway we need to go. We need more coverage, and we need some uncompensated care dollars for people who simply aren't covered.
Well, I'm glad I asked you that question, because you actually tied a nice bow on what was a very confusing kind of scenario, but you explained it very well. I appreciate that, Elena. Thank you so much for your conversations with me on a regular basis as it relates to health. Thank you for what you do on behalf of those who really need the help and support. Thank you.
Thanks very much.
All right.